Hello. During this session, we shall be discussing the presentation of pathological skin conditions in minority ethnic patients, and we shall be looking at some of the unique challenges we face in detection of uh, skin disease in Black patients, uh, and we shall also try to work out some strategies to help in our diagnosis. I'm sure many of you recognize that cutaneous manifestations of certain diseases may be subtle and difficult to identify in people from minority ethnic backgrounds, particularly in Black individuals. Some examples of such skin conditions include cyanosis, petechiae, purpura, ecchymosis, pallor, erythema, and rashes involving the skin. Unfortunately, cutaneous signs of disease in Black people have not been depicted adequately in the medical literature, and there is lack of representation of uh, teaching of skin signs and symptoms in uh, teaching and training of healthcare professionals. And also, historically, dermatology has been a wide specialty, and little attention has been paid to the challenges associated with recognition of skin conditions in Black individuals. Uh, there is abundant evidence in the literature that lack of attention and focus on Black people in teaching and training may lead to delayed diagnosis, inadequate management, and poorer outcomes for minority ethnic individuals, particularly Black people. And it is essential for us to recognize cutaneous signs in people with dark skin to enhance the cultural competence of healthcare professionals, including dentists and dental therapists, so that it has a positive impact on the healthcare experiences of minority ethnic individuals. As we all know, UK is a very multicultural and multi-ethnic diverse society now, and you would routinely be seeing patients from minority ethnic backgrounds, and as part of your cultural competence, you need to be able to recognize the variations of skin signs and symptoms in people from minority ethnic backgrounds, and that is what we are going to discuss in this session. Before discussing specific skin conditions, I just want to highlight the racial disparities which have been observed during the recent, in fact, the ongoing COVID-19 pandemic. A recent literature review in the British Journal of Dermatology found that out of 36 studies showing images of COVID-19 presentations on skin published between 2019 and May 2020, there were zero images of dark skin tones. And we know that minority ethnic uh, people are at a high risk of uh, contracting COVID and the associated and developing associated complications, and there is a higher mortality rate as well. Despite that, the literature published uh, in relation to the COVID-19 pandemic seem to ignore uh, signs and symptoms of disease in Black individuals. So you may be aware that the Fitzpatrick skin tone scale is used to grade the skin tones, starting with 1 as the lightest skin color, all the way to number 6, which is the darkest skin color. And uh, 92% of the 130 images which were published in these papers related to the first three categories of the skin tone, from the lightest colored skin to a medium tone. And there were not a single image related to the two darkest categories of skin tones. Similarly, 1,000 images in the COVID-19 studies from Spain, France, Italy, US, and Canada also showed that all patients were white, even though the US has a high proportion of uh, Black population. So this just highlights the fact that how skin changes and pathological conditions in black individuals have been ignored over the decades, and it's only now that we are recognizing uh, lack of representation of minority ethnic individuals in the teaching and training of healthcare professionals. Before discussing specific skin conditions, uh, we need to talk a little bit about some general considerations and tips for detection of skin changes in people from minority ethnic backgrounds. Uh, as we've already discussed, that cutaneous signs are more subtle in people with dark skin. And in fact, the darker the skin tone, the more difficult it is to detect these changes. In white people, for example, clinicians may be able to detect skin changes even on a casual glance. However, this may not be true for a variety of skin conditions seen in black individuals. So, we'll just discuss some tips you can use in your clinical practice uh, to detect these changes when they may be more subtle in people with dark skin. So it's important that clinicians must look actively for skin involvement in black individuals, and clinical examination should be contextualized to patient's medical history and presentation, and based on these, you should actively look for any related skin changes. And what you would find is that it's very helpful to check with the patient and their attendants when appropriate if they have noticed any changes in skin color, appearance, such as swelling, skin eruptions, any areas of tenderness, etc. And they can actually help you quite a lot because they would know better if they have if there are any changes involving their skin. And it's also important that you have good lighting and you carry out close and meticulous inspection and palpation of the skin uh, as dictated by the clinical examination and assessments. It's always helpful to compare uh, the skin bilaterally. So cases where there is unilateral involvement, you would be easily be able to identify differences between right or the left side, and that can help you quite a lot. One of the skin conditions which is generally more challenging to detect in people with dark skin is cyanosis, which is a bluish-gray discoloration of skin and mucous membranes due to poor oxygenation of hemoglobin, and typically develops when the deoxygenated hemoglobin levels are greater than 5 grams per deciliter. So it's the uh, amount of deoxygenated hemoglobin which leads to the development of cyanosis. So cyanosis detection on black skin requires additional 3 to 6% more arterial oxygen desaturation than in white individuals. So generally speaking, uh, uh, cyanosis is fairly easily recognizable in people with white skin. It can, or even medium tone skin, and it can be seen on the fingers, the extremities. That is what we call peripheral cyanosis, and it can also be seen on the lips and the mucosal aspect of the lip and the tongue when we call it central cyanosis. So as we said, we classify cyanosis as central or peripheral cyanosis. Central cyanosis is primarily caused by circulatory or ventilatory problems, respiratory problems that lead to poor blood oxygenation in the lungs. And it develops when arterial saturation drops to less than 85%. So these are some of the causes of central cyanosis. So central nervous system conditions involving the central nervous system which impair normal ventilation, such as intracranial hemorrhage, drug overdose, tonic-clonic seizures with grand mal epilepsy. For respiratory system, asphyxia following respiratory obstruction, pneumonia, bronchospasm, which may be associated with asthma, chronic obstructive pulmonary disease, and less commonly pulmonary hypertension or pulmonary embolism. Looking at cardiovascular causes, congenital heart disease, heart failure, valvular heart disease, including its complications such as infective endocarditis, myocardial infarction, uh, hematological causes, methemoglobinemia, uh, and polycythemia. And finally, central cyanosis may be observed at high altitudes greater than 2400 meters, hypothermia, or obstructive sleep apnea. So all these causes eventually lead to poor oxygenation of the hemoglobin, increased level of deoxygenated hemoglobin, and central cyanosis uh, indicates a more serious problem and uh, will eventually be accompanied by peripheral cyanosis. However, remember that central cyanosis is a late sign of hypoxia. So obviously, it would not be clinically visible even in white individuals until the oxygen saturation drops to less than 85%. And then you require additional desaturation of oxygen for cyanosis to manifest in people with dark skin. And that's why it's important to detect this early to ensure appropriate management of these patients. Central cyanosis, even though a more serious condition than peripheral cyanosis, can be detected uh, even in patients with dark skin, and you need to look at the lips, particularly the mucosal aspect of the lip and also the tongue, because oral mucosa, even in black patients, does have a pink appearance. So this is an image from a black person, and you can see the mucosa is, uh, you know, quite similar to what you would see in white individuals. So cyanosis can be recognized uh, on the tongue and the mucosal aspect of the lip more readily, even in dark-skinned individuals. Peripheral cyanosis is grayish-blue tint in fingers or extremities and is due to inadequate circulation. So it can be caused by all common disorders leading to central cyanosis. So central cyanosis is uh, also accompanied by peripheral cyanosis, exposure to cold, arterial obstruction as seen with Raynaud phenomena, which is an idiopathic disorder resulting from transient spasm of blood vessels in the fingers and toes, primarily the capillaries, and it can also be seen with peripheral vascular disease uh, secondary to atherosclerosis, and can be observed in patients with a history of diabetes mellitus or hypertension. And finally, venous obstruction secondary to deep venous thrombosis can also lead to peripheral cyanosis. And peripheral cyanosis is mainly seen, as I said, on the fingers and toes, on the extremities, and it is the peripheral cyanosis which is more difficult to detect in people with dark skin. Now, obviously, if peripheral cyanosis is accompanied by central cyanosis, then it's easier to detect it on the oral mucous membrane, the inner aspect of the lips, the tongue. However, if it is isolated peripheral cyanosis in people with dark skin, then you may want to look at the fingernails where it may be more visible. These images depict peripheral cyanosis involving the fingers and the toes. Obviously, this is quite remarkable, but this may not always be the case in your patients. And if it is relatively mild or less well established, then it may be difficult to detect in patients with dark skin. And we shall look in the subsequent slides how you can identify peripheral cyanosis in patients with dark skin. So here is a quick summary of the key differences between central and peripheral cyanosis. So as we've already discussed, inadequate oxygenation of the systemic arterial blood or hypoxic hypoxia secondary to cardiorespiratory or causes or involvement of the central nervous system causes central cyanosis, whereas peripheral cyanosis is related to sluggish peripheral circulation or stagnant hypoxia. But remember that central cyanosis will also be uh, associated with peripheral cyanosis. The same name may not be true for uh, peripheral cyanosis secondary to Raynaud's or peripheral arterial disease. So sites to look for central cyanosis are soft tissues of the oral cavity, including mucosal aspects of lip and the tongue, whereas peripheral cyanosis is more obvious on the tip of the nose, ear lobules, fingertips, nail beds, extremities, and sometimes central cyanosis due to cardiorespiratory causes may be associated with finger clubbing. Finger clubbing is unlikely with peripheral cyanosis, and generally the extremities are warm in central cyanosis but cold in peripheral cyanosis. And warming the extremities will make the peripheral cyanosis disappear or reduce in magnitude. The same is not true with central cyanosis. On the other hand, oxygen inhalation will show some degree of improvement for central cyanosis, but generally no change with peripheral cyanosis. The arterial blood gases, the oxygen saturation uh, generally reduce below 85% with central cyanosis, whereas with peripheral cyanosis, it may be slightly low or even in the normal range. The pulse volume may be high with central cyanosis, but usually low with peripheral cyanosis. And finally, because of cardiorespiratory or central nervous system involvement, central cyanosis, depending upon the cause, may be associated with dyspnea, but with isolated peripheral cyanosis, dyspnea is usually not present. Just to summarize that when trying to detect cyanosis in black individuals, uh, it is helpful to observe the lips, the tongue, nails, and the conjunctiva because cyanosis may be more readily detectable at these sites compared to the peripheral skin. And it may also be useful when appropriate to ask the patient or their attendant if they notice any changes in skin color at these sites. Another common skin sign which is often difficult to detect in people with dark skin is pallor of the skin and mucosa. Pallor often indicates anemia, but may also be related to emotional stress, shock, or stimulant use, and it is caused by reduced levels of oxyhemoglobin. Whilst pale skin may be fairly easily detectable in patients with white skin, that is not the case with detection of pallor in black individuals. So it may be actually helpful to examine the conjunctival mucosa as well as the oral mucosa, and you would be able to detect pallor in black individuals at these sites. And you may be aware that uh, anemia is a risk factor for a variety of oral conditions, including aphthous ulcerations. So if patients present with oral ulcerations and you suspect anemia, you can always refer them to their GP for further investigations and management. And therefore, you can actually make a meaningful contribution to holistic care of your patients by uh, recognizing and referring for previously undiagnosed systemic disease. Skin erythema or redness of the skin may develop secondary to a variety of uh, causes, including inflammation, infections, and allergies. And whilst it may be very obvious in patients with white skin, uh, that may not be the case in dark-skinned individuals. And in fact, the darker the skin, the more subtle would be these changes, erythematous changes. So if you look closely, you can notice dark purple discoloration of the cheeks bilaterally adjacent to the nose. And obviously, it's not clear unless you look very, very closely. So it may be helpful to also palpate the skin and see if the skin is warm on touching, uh, secondary to inflammatory changes, and also if it's tender, and if you notice any uh, edema or changes in skin tone and turgidity. So you need a really close examination to recognize these changes, erythematous changes in people with dark skin. So people from Asian backgrounds, the skin changes may be reasonably obvious, but in people with dark skin, you need a really, really close examination. And you might also want to ask the patients if they have noticed any changes. You can provide them with a face mirror so they can look at their face and identify any changes. So skin erythema may be associated with a variety of uh, oral infections, even abscesses, cellulitis, and similarly dental infections. So it's important to recognize skin involvement uh, in such situations because it will dictate your management, including the possibility of referral. Other skin conditions which may be difficult to detect in people with dark skin are purpura and petechiae. So these are lesions which develop secondary to subepithelial bleeding, and petechiae are pinpoint hemorrhages which are less than 3 millimeter in diameter, while purpura is uh, a larger area of discoloration following subepithelial bleeding and is usually 3 millimeter to a centimeter in diameter. And you can clearly see that on white skin, you can clearly identify areas of pinpoint hemorrhage along with purpura. So both uh, purpura as well as petechiae, multiple petechiae on the limb can be seen very clearly uh, in patients with white skin. This is not the case in people with black skin. Probably both have similar areas of involvement and similar extent of lesions, but you can only see one or two areas of purpura, and the rest of the kneecap, the skin over the kneecap, it's not very obvious if there are any petechiae present, but close attention would show you uh, dark discoloration, darker areas of skin discoloration interspersed with normal skin, which probably indicate presence of petechiae and additional areas of purpura. So again, close attention, close examination, probably also asking the patient or their attendants if the skin appears to be normal to them, or whether they notice any changes. And again, it's helpful to compare bilaterally, because if there is unilateral involvement, then it's much easier to detect skin changes in people with dark skin. So these images show other examples of extensive petechiae and purpura in a child with Hanoch-Schönlein purpura, which is a form of vasculitis seen in children. So you can clearly see uh, petechiae and areas of purpura in a white patient secondary to immune-mediated vasculitis. So it's fairly easy to recognize these changes. Extensive areas of cutaneous purpura can be recognized even on the darker skin, as you can see in these images. However, if the extent of involvement or the uh, number of lesions are less, or the presentation is less remarkable, then it may require closer attention to detect these skin changes in people with dark skin. Another type of bruising is known as ecchymosis. So ecchymosis is bluish discoloration of skin secondary to subepithelial bleeding, and typically ecchymosis, the bruising associated with ecchymosis covers a larger area, usually a centimeter or more in diameter. So here you can see two examples of ecchymosis. The first one is periorbital bruising and subconjunctival hemorrhage following midfacial trauma, possibly associated with an orbital floor fracture. And on the second image, you can see an extensive area of ecchymosis on the chin following trauma to the chin and a possible mandibular fracture. And as you can see, it's fairly obvious in people with white or medium skin tones. So here again you see periorbital ecchymosis associated with midfacial trauma and a possible zygomatic bone fracture, and similarly uh, bilateral periorbital ecchymosis, subconjunctival hemorrhage following midfacial trauma, and a possible maxillary fracture leading to flattening of the nose. So, depending upon how extensive it is, uh, ecchymosis may be visible even on darker skin. However, it may be more subtle in people who are black, and then you have to relate your clinical findings with your imaging findings on imaging like radiographs and CT scans, etc. And then you may be able to identify areas of ecchymosis on dark skin, and usually ecchymosis is related to trauma. Towards the end, we can also look at some of the ethnic variations in the appearance of the oral mucosa and how it impacts on detection of pathological conditions in the mouth. So I'm sure all of you are aware that racial pigmentation is common in black individuals, and increased melanin pigmentation may impart a darkened appearance to the gingivae. Although the rest of the oral mucosa may also have a slightly darker appearance compared to the white individuals, but generally the appearance of the mucosa related to the tongue, the palate, and the buccal labial mucosae is not much different, and detection of pathological changes is usually straightforward. Melanoma is a skin malignancy which is very aggressive and has a much poorer prognosis than other common skin malignancies such as basal cell carcinoma and squamous cell carcinoma. Although it's primarily a malignancy which is seen on the skin, up to 1% cases of melanoma could be intraoral, and the two most common sites for intraoral melanomas are the palatal mucosa and the gingival mucosa involving the uh, maxillary alveolus. Now, when these lesions occur on the palate, it is usually straightforward to identify them. However, if melanoma involves the gingival mucosa in black individuals, there could be a risk of delayed diagnosis because of racial pigmentation. Some additional features which may help you identify melanomas are presence of a rough surface, asymmetry, uh, rapid increase in size, and bleeding. So if you identify pigmented lesions on the palate or the maxillary alveolus, you must refer them urgently to the local MaxFax department under the 2-week wait referral pathway. And you've got to be extra cautious in black individuals when identifying pigmented lesions involving the gingivae particularly. Apart from pigmented lesions involving the gingival mucosa, most other pathological lesions on the oral mucosa are fairly easily detectable in black individuals. So you can see uh, diffuse white discoloration of the palatal mucosa as well as the dorsum of the tongue and the buccal mucosae bilaterally. So there are extensive white lesions involving these areas. So this is a case of acute pseudomembranous candidiasis in a black individual, and you can easily appreciate that it wouldn't be too difficult to detect these changes uh, in a black individual. Similarly, white lesions associated with leukoplakia, lichen planus, etc., can also be detected fairly easily in black individuals. And on the right, you can see multiple raised lesions involving the upper lip, labial mucosa, close to the oral commissure as well, a large lesion. And these are basically HPV related warts, intraoral warts. And again, you can see it's not too difficult to detect these. Similarly, intraoral ulcerations are not too difficult to recognize in people with black skin. And as you can see, there are multiple ulcerated lesions involving the ventral surface of the tongue as well as the oral floor. And as you can see, uh, these can be recognized fairly easily, and skin color of the patient should not impact on recognition and diagnosis of these lesions. Leukoedema is an interesting condition. It is seen in up to 90% of black people and is related to presence of edema in the spinous layer of the oral mucosa, which imparts a grayish white discoloration to the buccal mucosae bilaterally. And what is interesting is that when you stretch the buccal mucosae, the uh, the discoloration disappears partially. So it's not a disease condition, it's an anatomical variation seen in black people. So it's important that you recognize this condition so you do not diagnose it as a pathology such as leukoplakia or lichen planus or candidiasis. Just like white lesions, red lesions on the oral mucosa in black individuals can be detected fairly easily and quickly. So both images show erythematous lesions involving the palatal mucosa related to acute atrophic candidiasis on the tongue with kissing lesions on the palate. So obviously, the image on the right is from a white individual, and you can see the erythematous lesion is lighter in color and bit more obvious. Uh, in the black individual, even though the lesion appears slightly darker, but it can be detected easily, and you shouldn't be missing these. We can summarize the key learning points from this session as follows. Firstly, it is fundamental that we recognize that skin signs may be more difficult to detect in people with dark skin, particularly black individuals. And as healthcare professionals, we pay close attention to history and clinical presentation, uh, especially in black people, to look for relevant signs actively, as opposed to white people, where some skin signs may be very obvious at a first glance. You may need to look more meticulously and actively for skin signs in people with dark skin. And as mentioned before, it is often helpful to involve patients and their attendants to aid in detection of subtle skin changes whenever appropriate. Obviously, it would be more difficult and may not be possible when dealing with medical emergencies, but for all routine assessments, this strategy could be really useful. And finally, we must utilize additional investigations to correlate the clinical findings as and when appropriate. For example, assessing vital signs using pulse oximetry and blood test by liaising with the medical colleagues as and when warranted by the clinical findings. In the end, I would like you to uh, read this article, which highlights the issues related to racial inequalities in dental education and how it impacts on minority ethnic patients, and this will enhance your understanding on the topic. Thank you. In the end, I would like to acknowledge student equality champions at the Peninsula Dental School who are putting in a lot of work on decolonization of the dental curricula and also developing additional resources uh, for the school and engaging in research to highlight racial inequalities and the need for decolonization of the dental curricula. Well done and keep up your hard work.